We're coming out of the pandemic right now, and anxiety, depression, loneliness, stress are at the highest levels they've been probably ever recorded, according to the CDC and other agencies that have been surveying this type thing. And some of this is because they have lost jobs, they've lost businesses.
It's the helplessness,
Yeah,
the feeling of
yeah,
helplessness. Yeah.
they've lost homes, they've had problems, marriages are failing and all. And I'm not saying if you go get TMS treatment that all of a sudden you're going to get your job back and your financial problems are going to go away, but you're going to be better equipped to cope with, overcome, look for solutions to, and deal with that. Because when you are depressed, you're not as cognitively efficient as you would have been otherwise. You're not as active. Your energy levels, everything goes down biochemically, physiologically, psychologically. Everything goes down when you're depressed. And if you're anxious, again, you're distracted. You're hearing a lot of noise and stuff. You're not nearly as efficient concentration wise because you have all this going on in your head. Now, you said if it weren't for the fact that these are a bit expensive, nationally around the country, what do these kind of treatments generally cost someone, and does insurance cover them?
Well, the good news is insurance is now starting to cover them. And so the Blue Cross and even Medicare are seeing the tremendous results from this. So this is, as we're speaking, they're becoming covered by insurance. When not covered by insurance, it's about $400 per treatment. So that's for a course of 30 treatments. That's quite significant for most people. And even though the benefit from that, they feel it, and the productivity, getting back to their life, makes it worthwhile. The medication is very expensive too if you're taking pharmacological meds for this, but it's about $350 to $400 a treatment, I believe.
Okay, so, and you're talking about 25 treatments.
I think it's about $7,000 for $7,000 to $8,000 for a course of treatment. Yeah.
Okay.
But insurance is going to come through, and we always help people as well. As you know, we often do it for
I don't know how you
nothing.
stay in business.
Yeah. Well, sometimes they're heartbreaking stories, and there's a tremendous good feeling for our team when we help people. So it's not always about the financial component.
Are there places around the country that do a good job on this?
Yeah, I think they do. And they use the traditional treatment. What we're talking about today is something that outside of certain academic and very specialized institutions are not being able to do, the targeted imaging-based TMS, where you're actually able to subselect areas of the frontal executive area and concentrate on those. So the traditional treatment that's been going on for 7 or 8 years is a general treatment to the general area. They get about a 58% improvement rate. And there are centers all over the country that do it without imaging guidance. Now, we will provide the imaging and send the database to the TMS centers, and there are plans to educate all those psychiatrists on how to use the imaging-guided system.
So the primary impact now is depression and anxiety.
Yes.
And, of course, that is comorbid to so many other things. So whether you're dealing with a primary diagnosis of PTSD or whatever,
traumatic brain injury, or
TBI,
or especially things like brain degenerative disease. Depression is one of the most terrible parts of Alzheimer's disease. And if you can get people out of that depression, you're stimulating neurological tissue in a patient with a brain that's degenerating. You can give them more time before they have their memory slip away. And
it's got to seem like it rolls the clock back.
Yeah,
I know it doesn't. I'm just saying.
It just keeps the neurological tissue regenerating itself. And in stroke and in multiple sclerosis now, there are also very big applications for this. So it's a big advance generally, and I think we're going to see a lot more of this.